Reach. You can go live now.
Good afternoon, viewers. Welcome to Cancer Reach. Cancer Reach is an initiative by Dr. Krishnamani to spread awareness on cancer and also help the patients and caregivers to access the right treatment on right time. As you all aware, January is known for Cervical Cancer Awareness Month. On this occasion, we have Dr. Krishnamani with us to share knowledge more on cervical cancer and how it is important in the women's health. And cervical cancer is a one thing that caused the third most leading cancer-related death in women in India. So this is a right time to learn more from Dr. Krishnamani and protect ourselves from cancer and take more cautions about our lifestyle. Welcome, Dr. Krishnamani.
Thank you very much. Welcome all to Cancer Reach.
Sir, we request you to give your opening remarks for this live session.
So, as always, welcome all to Cancer Reach, which is an initiative to spread awareness on our part on cancer. And today we are going to talk about a very, very common cancer in India and a very preventable cancer, which people consider kind of a taboo, where we don't talk much about it, but it is extremely common. It is extremely preventable. There is a method to detect the cancer early, which many people want actually. People keep asking, how can I detect cancer early? So this is one disease which is common, which affects women, which is deadly, which is preventable, which is caused by an infection, which can be detected early by screening, and for which a vaccination is available. So in all ways, it is a cancer which is kind of where you can do something so that people don't get that cancer, but the awareness amongst people is not that great. That's the reason we see many women with advanced cervical cancer who unfortunately succumb to their disease.
Doctor, thank you very much for your opening remarks. Can you please brief us a little about what exactly cervical cancer is and how common it is in India and in Indian women population?
So, cervical cancer is the second most common cancer in women in our country. It used to be the number one cancer in women some time back. Now it is number two cancer in women in our country, the first being breast cancer. So when we talk about cervical cancer, I'm talking to you from an Indian perspective. Historically, we used to say that breast is a cancer which is seen in the urban population, and cervical cancer is seen in the rural population, because cervical cancer is associated with illiteracy, uneducation, unemployment, poor people, low socioeconomic status in rural settings. But that scenario is changing. So you see a lot of people, we are from Hyderabad, people from Bangalore, you see a lot of people who move from the rural areas to the urban areas in search of a living. So diseases are no more confined to rural versus urban. That distinction is gone. India is growing, we are developing, it is fast paced. So there is migration of population. So also the migration of diseases from one geographical area to another. So the bottom line is it's an extremely common cancer. It is the second most. It was predominantly believed to be seen only in the rural part of the country, but no, we also see it in the urban part purely because a lot of the workforce is still in the urban areas. And it is the second or the third leading cause of death in women also due to cancer in our country. So that is also an alarming fact. Not only is the cancer common, but unfortunately, this cancer is also killing people. And the death apart, the morbidity means suffering due to cancer, is enormous. That you should only ask a cervical cancer survivor or a patient to ask what she has or gone through when she goes to the hospital for her chemo sessions, for her radiotherapy sessions, or if she has had a surgery, or if she has a recurrent disease, the pain they undergo. So overall, uh, it's a very common disease, and it's a common cause of cancer death in women. That is what we should understand, and the rural-urban divide has kind of merged now. And that is why the need on our part to spread the awareness that we have such a common disease on hand, and what all we can do to prevent and contain the disease, we must.
Thank you, doctor. As you rightly said, now there is no difference between the rural population and urban population because both are well connected nowadays. And as you rightly said, education is another part, and knowledge and awareness and hygienic and lifestyle many things that's going to be influence the incidences and prevalences of this cervical cancer. And doctor, what are the risk factors for this cervical cancer?
See, broadly, what we should understand is cervical cancer is in more than 99 or almost 100% cases caused due to the virus, which is called the human papilloma virus. So, now for example, I have a foot pipe cancer, okay, or a very rare variety of, say that I have a very rare variety of a muscle tumor or sarcoma. Many a times you don't know the reason. But this is a cancer where if a patient comes and asks me, Doctor, how do I get cervical cancer? What is my risk factor? HPV. Human papilloma virus is responsible for cervical cancer in almost 99.7% cases worldwide. That's close to 100%. In HPV, there are a lot of numbers. They have named the HPV. Some are called high risk HPV, some are called low risk. So then the viruses are numbered like 6, 11, 16, 18. They are called high risk. So if you get HPV of these four subtypes, there is a high risk that you will get cervical problems. Okay, that could be cancer or pre-invasive, that is pre-cancerous conditions also. So the bottom line is cervical cancer is equal to HPV infection. That's all.
Doctor, is it a common infection in anybody, HPV?
So how do you get HPV is the cause. It is not some rare thing sitting somewhere in the forest and you are going and getting it. It is not like your the Nipah virus or whatever which comes through bat once in a while or all. It's pretty common virus. How do you get it? So you get it just like how you get HIV.
HIV.
So uh, not all the factors are the same, but through the sexual route. So cervical cancer is a sexually transmitted, is caused by a virus which is sexually transmitted. So now who is at risk? So now suppose somebody has multiple sexual partners. Somebody has a very high risk promiscuous behavior. Okay. Then somebody who starts uh, the sexual activity at a very, very early age. Somebody who is in a sexual relationship with the high risk individual.
High risk
I
individual.
have HIV, somebody is in touch with me, then obviously I am going to transmit the virus.
Understood.
Okay, smoking increases the risk of cervical cancer. So broadly, it is high risk sexual behavior which is responsible for cervical cancer. Apart from that, hygiene. Okay, and all this is commonly seen in what kind of a population? In population which is in the very low socioeconomic status, which is exploited, especially in a country like ours. Okay, a woman who's from a very, very low socioeconomic status, who's illiterate, who's uneducated, who is exploited repeatedly, is somebody who would be, and from a very young age, who is somebody whom you would consider a classic case who will probably develop HPV infection and cervical cancer later. An urban, educated, suave, well-read girl who understands everything would not involve or indulge in high risk behavior. So that's why her risk of getting cervical cancer or HPV infection is much low. So that is the basis
But
for this rural urban thing. We broadly said rural people will get, urban will not get. No, even urban person has all these, he is also going to get.
one because of lack of knowledge, another because of unaccepted behavior.
Unaccepted. So unacceptable behavior. What is you cannot call it acceptable. What is acceptable to them may be unacceptable to me. But this is called high risk promiscuous behavior. So this spreads the virus from one person to another. Once you get the virus, the disease progresses from one stage to another. Immediately, it doesn't go and sit in cancer. It doesn't go to cancer. Cervical HPV infection immediately doesn't lead to cervical cancer. There are multiple stages. It starts from which we will come to. So it comes from one stage to one stage to one stage where you can pick it up early also and finally lands at cervical cancer.
But at least in the point of the cervical cancer view, that unprotected sexual practice or multiple partner sexual practice, it is not accepted by the
Correct.
behavior.
So correct. So for one's own health, that is not good, obviously. So for one's whole health, it is not good. So when you know the risk factor, avoid the behavior.
Hello,
Yeah.
sir. Am I audible to you?
Yeah. I am.
Yeah, we lost your
audible.
connection in between
Fine.
due to the
So
network issue.
bottom line is high risk sexual behavior leads to faster transmission of the virus, which is singularly responsible for cervical cancer.
Yes, sir. But how one can reduce the risk of this cervical
Very
cancer?
simple, right? Do not have multiple sexual partners. Do not be in association with somebody who is a high risk individual. Okay, oral contraceptives seem to increase the risk, so try to avoid. Obviously, stop smoking. And what else can you do? The beauty is take vaccination and get yourself tested for HPV with a pap smear test or a HPV testing. So now comes to the question that stop smoking, stop high risk sexual behavior, that is early onset, multiple sexual partners, and all these kind of things. And then comes to boys and girls. Now I'm stressing boys and girls need to get vaccinated for the with the cervical cancer vaccine.
Doctor,
We'll come to that.
can you give little elaborate on what exactly this vaccine and how it is taken and how
So
frequent it has to be taken and all?
great. So now we had COVID. It is caused by a virus. So we made a vaccine. Okay. So basically, mumps vaccine, measles. What is a vaccine? Vaccine is a shot of that probable etiology. Etiology means cause. What causes your problem? So in mumps, measles, rubella, it is a virus. So the researchers have made a vaccine which contains dead inactivated virus, which if given to the human body produces an immune response which will prevent you from getting the infection if you contact that virus directly. So
Got it, sir.
vaccine is to prevent disease by containing elements of that infection or the causative agent. So here,
Indirectly, we are preparing our body to fight against the new infection.
excellent. So now I told you four valent vaccine, four viruses, 6, 11, 16, 18, high risk. So you are not bothered about the low risk one. That is not going to trouble you and me. So high risk, they prepared a vaccine, 6, 11, 16, 18 called quadrivalent. Quadri means four valent vaccine. So all these four things are there in that vaccine. That protects you against most cervical cancer. Now, the next level is 9-valent vaccine. Not only four strains, they have 9 strains, and they put that, and that is very predominant. That I believe in the United States, you only get the 9-valent vaccine now after 2016, 2017. So we have a quadrivalent, we have a bivalent, two, we have a 9-valent vaccine. The more the strains, the better. Common is quadrivalent. In India, we have the quadrivalent. So you give that vaccine to reduce the risk of infection.
And doctor, what age it has to be taken? What is the right time to take this vaccine?
So the right time is somewhere between the ages of 9 to 13.
9 to 13 years.
Or 12 and 13 is the right age, between the ages of 12 and 13, but we give it between 9 to 15 also. The manufacturer recommends it up to 22 also,
Okay.
9 to 22. But the parent, the right age is maybe 12, 13. So, whom to give? Only girls? No, even boys. Then what are we talking? This is cervical cancer, we are talking, and we're talking boys. How does that fit? That's a female reproductive organ. This is in males. This vaccine contains 4 virus strains. Now, this virus doesn't cause cervical cancer alone. It causes cervical cancer. It causes vulval cancer in women. It causes vaginal cancer in women. It can cause anal cancer in both men and women. It can cause oropharyngeal cancers in both men and women. It can cause something called anogenital wart. That can also be seen in boys and girls. So, and penile cancer, which is seen in boys. So, 6 cancers, 1 wart, 3 are seen in both boys and girls, and penile cancer obviously in boys. That is why you give it in boys also. So, boys and girls, preferably 12 to 13, or between 9 to 15. Manufacturer recommends up to 22 also. Okay. 4-valent is what is available in India. 9-valent is commonly used in US. Protects against these 6 cancers and 1 anogenital wart also. Before 15, if you give 2 shots. Now and 6 months later.
Okay.
After 15, you give 3 shots. Now, 1 month later, 6 months later. Why that extra dose for above 15? Above 15, they need one extra shot so that the funda is, once you are above 15, your immune response is lower. So you need one more vaccine to get your better immune response. That is in medical terms called seroconversion.
Zero
So
conversion.
you should produce more antibodies. So if you're below 15, you are good. 2 is enough for you to produce antibodies. If you are above 15, you need one more shot to push you. It was just like our
Booster.
booster dose in COVID.
Yeah. Can I take it something like the ideal time is before sexual exposure, like a boy or a girl? Is it taken like that, sir?
It is not ideal, it is mandatory.
It is mandated.
So, though again the guideline may say before the first few sexual exposures, common sense, you have sexual exposure, the other person has HPV, then what have you done? You've already got the virus. Then what is the use of the vaccine? So, the person should not be sexually exposed. Ideal age 12 to 13, between 9 to 15, maximum up to 22, before 15, 2 doses, after 15, 3 doses, boys and girls.
Doctor, is this recommended anybody like after any use of this taking this vaccine after 22 years? Like if someone want to reduce their risk in their lifetime,
They can, that is
is
called
it okay?
catch-up vaccination. But again, it will produce some antibodies better than a fellow who has not taken anything. But then you are not as good as a youngster or a young child.
Okay. So apart from this vaccine, doctor, because vaccine is always a prevention, it's a better than cure, right? But the people who are already above the age of 22, if they want to test whether they have that
Correct.
HPV virus in their body or not, how
Correct.
it is to be tested?
So now imagine there is a lady who is 24 years old. She is married. She has one kid. She has no high risk behavior. Okay. So we are talking about, the way we are all talking now is cervical cancer, and bad behavior set of people, and so the people who have a regular family life and all that, they need not be worried. No, no, no. So now comes the picture for a regular woman who is above 21, who is above 22. Even if you don't smoke, even if you don't take OCP, you are a lady who has no promiscuity or whatever you may call it, high risk sexual behavior, still do a pap smear every 3 years. What is pap smear? It is a cytology, that is, in the cervix area, just below the uterus, a small swab will be put and the cells will be taken and submitted to the lab to see if the cells are looking good or bad, to put it in very simple terms. Okay. So if the pap smear report comes as negative for malignancy, that means we don't have any intraepithelial neoplasia or malignancy. We have nothing to worry. This pap smear has to be done every 3 years, ideally. So ordinary women also, irrespective of sexual behavior, ideally get a pap smear done once every 3 years, or pap and HPV testing is done both together. That you can do once every 5 years.
Once every 5 years.
5 years. Till when should you do it? Up to the ages of 65. And after that, people are not very sure. You can continue if you are willing to continue every 3 or 5 years. If all your results were normal till now, you can probably discontinue.
Sir, there is a question. I'm sorry to interrupt, sir.
Mm.
I felt this question is a little interesting, so I thought of stopping here. One lady by name Shrestha, she's asking this question, like, where can I get this cervical cancer vaccine? Because
Anywhere,
I think maybe
anywhere.
she's asking for her kids. I
Freely
don't know.
available in the country, any hospital, anywhere.
Any hospital is it available, sir?
Most cancer hospitals would be having the vaccine.
Is it a cancer hospital or general hospital where they have to get this
Most
vaccine?
cancer hospitals for sure have. It is still not a part of our regular immunization program yet. So it is not like your hepatitis that the day you are born, you are given one tika and you are given other vaccines and all that. But for now, most hospitals in the country have it. Most cancer hospitals for sure have it.
If anybody want to get this vaccine, they need to approach any nearby cancer hospital and they can get
Many
it.
of our patients, once they learn about this vaccine and once they themselves suffer from so many other kinds of cancers, they get their children and they get vaccinated here.
Great, sir. Thank you very much. So let's go back to the testing, the pap smear. So you said it is to be recommended once in 5 years. Both the tests are suggested for any
PAP
common
once in
women.
3 years, PAP and HPV once in 5 years.
Okay.
This is the ideal. Now, many people have done great work in our country. So in the form of what? Now, in resource poor countries like India, or imagine the African countries which are so impoverished, what you cannot say, I am going to do, the book has told or the US FDA has said, do PAP every 3 years, so we are going to do. They have no access to food, sanitation, water, clean water. What are they going to think of your PAP smear and HPV?
Not possible.
In such places, what they say is, even if you do 2 PAP smears between the ages of 30 to 40, you pick up at least most cases of cervical cancer or even pre-invasive cancer. Something is better than nothing. Or there is something called visual inspection of acetic acid. Like in our country in Bombay, there was a big trial which was done by the Tata Hospital people, which was presented in 2013, where for many years, for close to 20 years, I believe, they have gone regularly to the slums. The trained Anganwadi workers, a doctor cannot go, pathologist cannot go, gynecologist cannot go, they're all extremely busy. So they have trained the Anganwadi workers. These people over a long period have gone to the poorest of the poor, and PAP can be done only by qualified people. Anganwadi people cannot do PAP smear. So they've devised a method called VIA, Visual Inspection by Acetic Acid, which was taught to these people. These people did the test on the ground in the field, and whoever they felt was abnormal, they got them to the Tata hospital, evaluated further. They were able to find set of people who had very, very early infection, which was treated early, set of people who were just in the pre-invasive form of cancer, and a set of people who had early stage cancer.
Amazing works.
The work they have done, and this is not in hundreds or 500, this is in 10,000s of people. I don't remember the exact figure. I think 20,000, 30,000 women followed over a period of 20, 25 years by Anganwadi workers trained by the medical fraternity on a simple test. So PAP and all that is in hi-fi hospital, in cities or in reasonably good hospitals or in teaching institutions. On the field, in resource poor settings, great people have done this work too. I am not saying it's a substitute, but something is better than nothing. It is called VIA, with which they have been able to prove the point that you should catch this disease early.
But same like other cancers, doctor, like how we were discussing in the previous sessions, like early detection will give the better results in the treatment, as well as it can prolong the survival of the patient. Is it same applicable even in cervical
Same.
cancer also?
You were probably, so there is a stage. It is called, so when you report a smear or a testing, there are some terms called ASCUS, atypical cytology of unknown significance. Then there is something called LCIL, low-grade squamous intraepithelial lesion, HCIL. So all this is not cancer; it is pre-forms of cancer. So if somebody has ASCUS or LCIL or HCIL, he may progress, she may progress to cervical cancer. You are catching them here itself and treating them by a biopsy or a colposcopy or whatever technique, and you are not getting into cervical cancer. Only if I get cervical cancer, I have stage 1, 2, 3, and 4. You're catching me much, much, much before that.
Great, doctor. I think knowledge is the most important thing here that can influence the patient's future. Definitely, because lack of knowledge is a one thing, and a lack of awareness is another thing, and many people who are not aware of this vaccine, that is most important thing I have observed, sir. Because even let it be personal side, like my family and my relatives and my unknown side also, I have never heard anybody undergone taking this kind of vaccine in their lifetime. So
Take my example now. In all the women in my family, how many would have taken the vaccine?
no,
Maybe I can just count on my fingers. How many have undergone the PAP smear as regularly as what I'm recommending?
no.
No.
But as the incidents are increasing, this is the time we need to change ourselves, and we need to educate more people to get vaccinated, I believe.
Correct. So this is one disease. So by what all we've discussed, you have understood. So this is a virus. You know the infection. You know your enemy. You have the medicine for that enemy. Okay. You know how to screen yourself. Everything is there. Yet we are not doing.
So we are just getting the knowledge, but not practicing it, to be frank.
So we are not even applying. And this is it is not some 100th cancer or 200th cancer in the incidence. It is
Not
the
most.
second most
Second.
cancer, common cancer in women, killing most women. And still, preventable cancer, we are not taking steps.
Right, doctor, because you said it is not only cervical cancer, it causes another 8 types of cancer in one ward. So it's a highly important thing to take away.
And also
So
understand,
take
the
it.
behavior itself can lead to this that kind of behavior reduces your risk of HIV, risk of hepatitis B, hepatitis C, sexually transmitted diseases, so many things. Not only on cervical cancer, your high risk behavior reduces your chance of getting other very bad infections also, which can cause other cancers also. Now, HIV cancers we spoke about in December. It can
Correct,
cause a
sir.
whole gamut of cancers. And
Correct.
HIV is also transmitted through the sexual route.
Right. But if anybody diagnosed with cervical cancer, how is the treatment journey is going to be? Like how long they
Very,
can?
very early stage, you get treated by surgery. In the locally advanced stage, and though that is not the discussion for today, but I'll broadly define very, very early stage surgery. Locally advanced, it is radiation as a predominant treatment with chemotherapy, and you also give brachytherapy, okay, which is another form of internal radiation. Advanced cases means disease has spread beyond, so they are treated with palliative chemotherapy with or without targeted therapy called a medicine called bevacizumab. Our aim is not to get the cancer or get it very early so that we can be cured. That's the whole aim of this.
Yes, doctor. So let's continue the session, further session in the next week with the treatment options and how it's going to be managed and how it has to be handled and everything with your knowledge.
Sure. Next time, what we should do is we should probably sit and discuss about how do patients present with this disease? How are we going to diagnose this disease? What are the stages and what are the effective treatment options and what are the newer advances in the treatment of cervical cancer?
Great, doctor. Thank you, doctor. Thank you very much for enlightening us on cervical cancer. So I hope this will help not only me, many people who are watching this session.
Thank you
Thanks a
so
lot,
much.
doctor.
Thank you. Thank you so
Have a
much.
great day, sir.
Thank you.